Coverage tonight. Channel 2's Brandon Walker live in the Med Center. And Brandon, we could exceed the ICU capacity as soon as today.
Yeah, Christine, the Texas Medical Center does project that. We'll know for sure first thing tomorrow morning when numbers for today are made available. What that means is once they reach that 100% for ICUs, they'll jump into what's considered a sustained surge capacity. They've planned for that. They've got the capacity. The problem here is if we enter into what's considered an unsustained surge. That's where we'll have a problem, and projections from the TMC show that we could be there, and as recently or as soon rather as 2 weeks. Tonight, a plea to help stop the surge from those on the front lines of the war against coronavirus. The Texas Medical Center issuing this warning, signed by leaders of 11 hospitals and medical schools in the Houston area.
We're hoping that we can put a lid back on the situation and keep things from getting worse. But in all honesty, we may already be over that point.
Dr. Brian Reed is chair of the Clinical Sciences Department at the University of Houston College of Medicine. Dr. Reed explains hospitals have prepared to handle an excess of cases to an extent. That's called surge capacity.
When we go over, the 100% capacity and go into surge capacity, we're pulling in additional resources, calling in additional nurses, using additional space to provide care.
But while there's consideration for sustained surge, doctors say it's imperative to reduce the number of patients being admitted.
Specifically here in the last 2 weeks, we've seen our cases over double, both in our intensive care unit and on our med-surg floors.
Dr. Bradley Lemke is Senior Vice President and Chief Medical Officer of Catholic Health Initiatives, which oversees hospitals statewide, including St. Luke's.
So today we're staffed and able to take care of the patients coming through our emergency department, as well as patients transferred into our organization. But we're close to our typical capacity.
If the rate continues to climb as it has, St. Luke's will reach its surge plan. St. Luke's surge plan includes bringing in extra staff to accommodate if need be. Yeah, and they're saying that they just want to make sure that they prepare for the worst. But right now they say they do have the resources to handle, but they're urging Houstonians to do their part, wear their masks, socially distance, stay home if need be, to control the spread. Projections, again, guys, having our area reaching the unsustained surge by 2 weeks from now on July 6th. Live in the Texas Medical Center, I'm Brandon Walker, KPRC Channel 2 News.